Hi there, this is Nurse Sally, and I want to share my experience with nicotine with you guys. I cannot even believe how amazing this has been for me. Um, I have to tell you, I'm in love with nicotine. I would have never ever tried it before, except I was super desperate because I had long COVID. It was affecting my heart. And if you've seen my other videos, you know that I had some really wonderful success with ivermectin as far as it helped me with my pain, the chronic pain issues, but it did not help with my heart, like not at all. So, and I'm gonna be honest, I'm gonna tell you what works and what didn't work, and sometimes you need more than one thing. So I am currently still taking the ivermectin, but this nicotine has been a game changer for my heart. Oh, it has helped my heart so much. So let me first of all say, nicotine is an antioxidant. It's found in tomatoes, it's found in eggplants. So once I learned that, and I felt a little safer to try it, it is in tobacco, obviously, but I have to tell you, in other countries, you can buy tobacco in like capsules, like actually like they use it medicinally. So like a supplement form, not in the US. And I had known that. I found that out years ago. So then when I started hearing all this talk about, nicotine doing this and nicotine doing that, I thought, well, maybe, but I didn't want to get addicted to anything. So I started learning that nicotine by itself is really not addictive. In some of the products like cigarettes, for example, they put other chemicals on there to make it addictive, and it's the other chemicals that make cigarettes and things like that so harmful, because I can't remember if it's 100 different chemicals on cigarettes, maybe 70s to hundreds, something like that. Like there's a lot of chemicals on cigarettes. So I'm not an advocate of smoking cigarettes at all. I am not against nicotine. It just depends on how you come about, obtaining it. So for me, I use the patches. I bought a 7 milligram patch. I cut it in half and I wear 3.5 milligrams. At first, I have to be honest, I only could tolerate it for like 4 hours a day. Then I got up to 6 hours a day. Then I got up to 8 hours a day. Honestly, I probably could wear it for 24 hours at this point. In fact, I had forgotten about it and went to sleep with it on, and it didn't affect my sleep. I just tend to take it off before bed because I am concerned that maybe it might keep me awake, and I work really long hours, and my sleep is so important. So, but I am going to build up to wearing it 24 hours a day, because what nicotine does is it binds to the same receptors that COVID-19 binds to. And there's some theories that perhaps even other viruses. So if you have around the clock protection, then obviously that's better than just 10 or 12 hours a day. However, let me say, even when I could only do it for 4 hours a day, I was seeing positive results. And of course now I'm wearing it 12 to 14 hours a day, and I'm seeing fantastic results. I had myocarditis from COVID. I had gotten worked up, and that's what I didn't have any vessel disease. I didn't have any sclerosis. It was just, well, I hate to say just, but it was myocarditis, which is more than just, okay? It's my heart being inflamed and not functioning properly. It was terrible. I could only go up and down. I had to be careful going upstairs. Sometimes I'd have to stop and take a break, which was terrible because prior to me getting COVID, I was in really good shape. So that was horrible. And I could not, it seemed like it was worse at night. When I would lay down, my heart would just take off. And it was the strangest sensation. I mean, it was almost like drums playing in my chest, and it was loud to me and thumping and loud. And who can just picture if you're like this. Now, obviously I didn't look like that, but that's how it felt. I couldn't sleep. It was really difficult to fall asleep. It was worse on my left side. I for sure couldn't sleep on my left side. So that was a huge problem. Still, I didn't really want to try nicotine. I was like, I don't know, I do enough stuff. What if it's bad for you? Like, I was afraid. But after 3 years of suffering with myocarditis and not getting any better, I was like, you know what? I don't have anything to lose. This is my heart. Like, it's a pretty significant issue. I have nothing to lose. So I started with the nicotine patch. Like I'm saying, I could only do it 4 to 6 hours a day. I would recommend, if you are going to cut it in half, maybe cut it in thirds and start with 1/3, so that you're not getting the full 3.5. Like, if you're sensitive to it, some people can start right out 3.5 and they're fine. I was a little bit sensitive at first. It doesn't bother me now at all. And I have been doing it for about 5 weeks. I don't have palpitations. I can sleep on my left side. My heart doesn't feel like it's going to jump out of my chest and run off and leave me. I can tolerate physical activity much, much better. I am still being careful because I don't want to, push it and pass out, because prior to the nicotine, if I pushed it with physical activity, I did pass out because my heart couldn't keep up. It was kind of scary. But I am, pushing myself a little bit with physical activity. And so far, I'm able to handle it. It's working out just fine. Like, I just got to tell you, I wish I had tried this 3 years ago. I had a naturopath who tried to get me to try it 3 years ago, and I was so terrified of it. But of course, if I had known that like that was going to be the only thing that was going to make me better, I would have done it. But I didn't know that. Now, I'm not going to sit here and say that nicotine is going to fix each and every problem that you have. Okay, there's other things that I'm dealing with, and I have to use other things, other products for those issues. But the nicotine, as far as for long COVID problems, has been an absolute game changer. And I don't really have any side effects from it. So whenever I told you that I could only tolerate it in the beginning for like 4 to 6 hours, let me tell you what I felt. So in the beginning, because I was a little sensitive to it and I started out with too much, I should have just done 1/3 of a patch. After about 4 to 6 hours, I would kind of feel weird. Like, I can't really explain it. It was almost like how you feel whenever your blood sugar drops, but that really wasn't the problem, but that's how I felt. And I would take the patch off, and after like an hour or two, I would feel completely fine again. Now, like I'm saying, I do not have that issue anymore. I am used to the product. I'm used to nicotine, and I'm doing fine. I also have shared this with some of my friends who are nurses, and like one of them was coming to work, and she had a Zoll patch on her chest, under her scrubs, and I'm like, oh my God, girl, what are you doing? And she said, well, my heart's all flipping out, it's acting all crazy, so they got me on this patch so they can monitor my heart rhythm for 24 hours. And I said, well, let me tell you what I'm doing, because I had the same issue. And I told her. She went and tried it. She's like, Sally, after the very first day, she felt better. And now she's not having any racing in her heart, no ectopy. She was throwing PVCs. I was throwing PVCs. And I know that because one time when it happened, I went to the ER like twice with chest pain, right? And shortness, whatever. I don't even want to get into all of it, but they hooked me up to the EKG, and I could associate when I had those feelings. I looked at the monitor. I was like, oh, I'm a nurse, right? So I'm like, oh shit. Oh, sorry. Oops. Oh shoot. It's just PVCs. Here I'm in flipping ER. I'm just having PVCs. Like, I can't wait to get this bill. This is so ridiculous. But that did help me to know, and they never found anything. I wasn't having a heart attack. All my cardiac monitors were negative. No, ST, depression, or elevation, nothing. Everything was cool. But the sensation that I had during, like, I would have left arm pain. I was having angina. Angina is what I was having, which will give you left arm pain. You think you're having a heart attack. I kind of felt sometimes like I was ending a yawn, but I couldn't fully exhale. And my rationale for that is probably my diaphragm was a little tight and couldn't completely relax. And I attributed that for me to long COVID, because COVID-19 for me really, really sunk into my thoracic cavity. I had costochondritis, I had myocarditis. I never had, thank God, like any true lung issues. It was more on the outside of my chest, in the thoracic cavity, like in the muscles, in the cartilage and things of that nature, but not actually in the lungs. I never had to wear oxygen or anything like that. So, and obviously it was in my heart. It was in a lot of places. I had a lot of issues. But I wanted to share that. If you are on the fence at all, if you are dealing with long COVID and you are just desperate, you don't even know what else to do, you know, I encourage you to try it. Check with your doctor first. I'm not your doctor. I don't know your issues, but how about I say this? I encourage you to research it and present it to your practitioner. That's what you should do. But for me, I have to tell you, I got to share my testimony. It was amazing. It was a game changer, life-changing. I mean, when your heart is holding you back, there's a lot of things you can't enjoy. You know, I couldn't go hiking anymore. There were so many just simple things. I was like, I can't really do that anymore. And now I can. I'm getting my life back. So I just wanted to share it with you. I wish you the best of luck. Please leave me your comments if you have any questions, or if you've tried this, I'd love to hear from you and see what your experience has been as well. Take care and God bless.